Hello and welcome to my channel. In this channel, we explain various nursing concepts in a simple form for a better and easy understanding. These videos could be used by both LPN and RN students as well as nurses who are trying to refresh their basic concepts. My name is Nasmosh. In this video, we're going to continue talking about the neurological disorders. More specifically, we're going to talk about seizure disorders, status epilepticus, and TIA. So seizure disorders. A seizure is an abnormal, sudden, uncontrolled, excessive discharge of electrical activity within the brain. Some of the causes include fever, toxicity or infections, brain tumor, trauma, drug or alcohol withdrawal. Seizures could be classified as either generalized seizures or partial seizures. So with generalized seizures, we have tonic-clonic seizures, which were formerly known as grand mal seizures, absence seizures, which were formerly known as petit mal seizures, myoclonic seizures, atonic or kinetic, which are drop attacks. With partial seizures, we have either complex or simple. So with complex, we usually with impaired consciousness, and simple is usually without alteration of consciousness. So that's the difference between simple and complex seizures with partial seizures. So what are the treatments? So treatment for seizures or interventions that we need to have for seizure patients is we maintain a patent airway by positioning the patient in side lying. A side-lying position, because if they're going through the seizures, we need those secretions to drain. I repeat, do not put anything in the patient's mouth. Monitor respiration status and loosen any constrictive clothing, okay? We're going to protect the client from injury. We are not moving the client. We are moving furniture away from the client. Do not put anything in client's mouth, as I said. Turn the patient's head to the side to avoid aspiration. Remember, we are putting them side lying. We are turning the head to drain those secretions. We document observation before, during, and after seizure. This is normally like a seizure log, right? So we'll take it back to the neurologist. We say, okay, the patient was doing this and the duration of the seizure was this. And after the seizure, this is how the patient, did they go back to normal level of consciousness? How long were the seizures? And most of the seizure plans go with the duration of the seizure. Like they will say, if the seizure is after 3 minutes, give them diastart or whatever protocol it is, or give them oxygen and diastart, or call the 911 for transportation. Okay, then we're gonna observe for prodromal signs or an aura. So some patients will always tell you, before I have a seizure, this is how I feel. And most of them, you let them know that when they feel the aura, let people around them know that, listen, I'm a seizure patient, or I have seizure disorder and I'm having an aura, I'm going to have a seizure, please, help me when I have a seizure. We document how long the patient remains unconscious, right? We need to know, because we need perfusion in the brain. We don't want to kill the brain. And lastly, we monitor and document behavior during the period following the seizure. What happened after the seizure? It's very important to know if there's any changes that occurs after a seizure occurs. So, and with this, we'll initiate seizure precautions when a patient goes into seizure. And what is this? The seizure precautions include, bed should include padded rails. They are shaking. You don't want them hitting their head in the process when they're shaking, right? Ensure immediate access to oxygen, and a suction machine is always available, and always bed in the lowest position. So some medication we'll see with these patients will be phenobarbital, valproic acid, phenytoin, lavectram, topiramate. So those are the common medication for seizure patient. Doses vary according to patient weight most of the time, and patient age and stuff like that. So what are the patient education that you need to give to your patients who have been diagnosed with seizure disorder? So they need to take their medications consistently. They should never stop it. You stop, the seizure comes. Teach them manifestations of medical or the medication toxicity. They need to watch out. Like with any medication, you overdo it, you end up with a problem. Get adequate rest to minimize fatigue. Give the brain a rest. They should avoid alcohol. They should wear a medical alert bracelet just in case they get into a seizure and, they have a seizure somewhere where people do not know them. They could see it and say, okay, this is a seizure patient, and they could get them the help they need. They should follow state laws in regards to operating vehicles and machineries. Some states do not, want them to operate vehicles because you're driving and you have a seizure. You're going to either kill yourself or you're going to hurt others in the process as well. So it's a risky situation. We always have them keep all follow-up appointments. They need to see the neurologist. And we should also teach them how to identify their seizure triggers. Because if we identify triggers, we prevent the occurrence of a seizure. Status epilepticus. So this is a life-threatening condition characterized by a series of generalized seizures without a full recovery of consciousness between them, right? Many may be caused by a sudden withdrawal of the anti-seizure medication, and it could lead to brain damage or death. So this is a situation where you're having a seizure back to back. You're not having that recovery period. And this, since you're having this seizure, you're cutting all this perfusion and circulation to your brain, you could end up with, brain damage. So what are the interventions? We initiate seizure precautions. And some of the medications we normally see with these patients, the medication of choice is normally lorazepam. We also see them with diazepam and phenytoin. In phenytoin, IV administration is slowly, no more than 50 milligram per minute. We do not mix with glucose. We administer this with 0.9% sodium chloride, normal saline, and we monitor for bradycardia and any heart block. So the last disorder we're going to talk about in this video is a TIA, which is a transient ischemic attack, a mini heart attack, right? You could call it that. So it's a sudden temporary episode of a neurological dysfunction lasting usually less than an hour, secondary to decreased blood flow to the brain, and it could be a warning of what? An impending stroke, right? That's what I say, a mini stroke. Some of the causes could be either non-modifiable or modifiable. So with non-modifiable, we are talking about things you cannot change. Advanced age, gender, which are male species, and also genetics. You can change those things. Modifiable things we could change, which include hypertension. We can maintain that. Hyperlipidemia, we can watch our lipid levels. Diabetes mellitus, control it. Smoking, stop. And arterial fibrillation, control it. Some signs and symptoms include a sudden change in visual function, right? Sudden loss of sensory or motor function. Some diagnostic procedures we normally use for TIA will be our carotid ultrasound, CT scans or MRIs, or a 12-lead EKG. All right, so treatment for this, for TIA, will encourage the patient to stop smoking and limit alcohol intake. We'll encourage them to consider using the DASH diet. What is a DASH diet? A DASH diet includes high fruits. It's high in fruits and veggies. It has moderate, low-fat products and low in animal protein. That is what a DASH diet is. We'll also talk about the stress, and we'll need them to decrease their stress and maintain an ideal body weight with regular exercise. Some medications that patients with TIA will see will be antiplatelets, which will include Ciprogel, anticoagulants, warfarin, right, Coumadin, lipid-lowering agents, right, and therapeutic measures will include angioplasty, right, or the removal of the plaque from one or both of the carotid arteries. Thank you for watching. Please like, share, and subscribe to my channel. See you on the next one. Bye.